and that's very common for a labral tear in a hip. Now, I was in athletic shape from age 16 until 37 when I got really badly injured. So my muscles' ability to compensate was pretty incredible. I could compensate and do just about everything without any pain. A little lack of range of motion, but no pain. So over time and with more and more activity, I started to develop repetitive strain injuries. Okay, so this is what can happen. You can get an injury treated, believe you've treated the cause, and 20 years later find out that you maybe treated a secondary injury or an injury that happened at a concurrent injury. So you treated one but not the other, so not everything was attended to. And after a long period of time, you develop muscle dysfunction. After the muscle dysfunction, you start to develop repetitive stress injury because it's kind of like you're pulling more on one set of muscles than another because you're not as even as you should be. Again, I was diagnosed with scoliosis. I could have gotten the scoliosis post skating injury, but I was never checked for it prior to that. Okay, let's move on. A long-standing chronic pain that's misdiagnosed. Okay, so this could be that you have had chronic pain for a very, very long time and it was not diagnosed. Again, I can fall into that category. My pain manifested in my lower back, my buttocks, and down the sciatic trajectory from my leg. And it became chronic. And I think that it started all from that labral tear because I was unstable and it started to get into my SI joint. My SI joint destabilized. I didn't have very much pain in my hip, but I had some, and I was told that it's very common to have pain in the groin area, like right where your leg joins your body, um, around the area where your psoas muscles are, if you know what the psoas muscles are, and it was overlooked entirely as a hip issue and became again very long standing even after I couldn't dance after I got my dance injury when I was 37. This kept going on this way and I was treated with the incorrect physiotherapy, the incorrect chiropractics, being in a compromised state. I believe that that treatment caused more strain on muscles that were trying to protect themselves, that were not working, that were full of knots, that were full of irregular tissue, full in an attempt to stabilize the area. And when those knots were worked out with deep tissue massage, and when my lack of my improper alignment was corrected through chiropractics, those muscles were constantly being torn at, as well as the physiotherapy, as well as everyday activities. So after a long period of time, I ended developing something called failed compensation syndrome, meaning that my muscles were under so much stress trying to compensate, under so much stress trying to get through physiotherapy that was inappropriate, that I started to get injured doing common everyday things that should never injure anybody. Things like bending over to pick something up, putting on a pair of pants, being in an awkward position and maybe having to handle 5 or 10 pounds of weight in that position. Then I'd get a pain or I'd hear a snap and I would just lose more strength and develop more muscle hypertrophy. So not atrophy, it didn't completely disappear, it just got smaller and smaller and weaker because I was getting more and more injuries in those muscles, more tears in the ligaments and tendons, deeper tears, worse tears through everyday activity, and I'd entered a downward spiral. So again, let's look at those three. Acute, obvious, long-standing trauma, acute, non-obvious, misdiagnosed, long-standing trauma, and long-standing chronic pain completely misdiagnosed. So the injury was completely missed and it's misdiagnosed as something else and treated as something else. And very probably you will develop more tears and more dysfunction, because until the injury is treated, the muscles cannot work the way that they're supposed to get out of the pattern of dysfunction. So if you're being diagnosed, for example, with muscle imbalance, I would caution you to really explore and do a process of elimination around the possibility that there might be an underlying injury causing that imbalance, and it's not just habits. For example, I was told that I had tight psoas muscles, but a really overly tight left one for some reason. No one did an ultrasound of it until years later, and it turns out it's torn. So that's why it was overly tight, because it was hypertrophied and tense due to injury. Now, if you think about it, it's very difficult to do unless you're standing or you're in a very specific type of activity, a strange type of activity. If your psoas muscles are due to sitting, you're usually sitting equally, and you're going to have both muscles be equally too tight in the front, maybe causing back problems. But if you have only an issue in one side, so when it should be bilateral, but it's only unilateral, it's really important to explore the possibility that you might have some kind of overlooked, undiagnosed injury causing that type of muscle imbalance. If it's bilateral, so both psoas muscles are equally tight and equally painful, and physio to stretch them out and rebalance your muscles is working and you feel relief on both sides, probably that's correct. But if you're engaging in physiotherapy for a unilateral muscle imbalance that wasn't caused by a unilaterally heavy or unbalanced activity and it's not working, I would say at that point really try to explore through diagnostic imaging. I would insist in diagnostic imaging, if you hadn't had it already, to see if that muscle imbalance could be the cause of an injury and not habits or poor ergonomics. I had been told that it was poor habits, poor sleeping habits, poor ergonomics, dance, etc., but it was actually injury. Okay. Now I'm going to move on to repetitive stress injuries. So repetitive stress injuries, anyone can get a repetitive stress injury. It's just what it sounds. You're causing stress on one joint or one structure in the body, or maybe a group of structures in the body along a similar kinetic trajectory, because you're doing something extremely repetitive. For example, carpal tunnel, typing, you're holding your wrists in a position that's not healthy for them, you start to develop carpal tunnel. Repetitive strain, my brother got a terrible shoulder injury because he had to pull microfiche, so he was doing this motion hundreds of times a day for a couple of years, working in a vault, in an archive, in a bank in Toronto. And he's got all kinds of tears in his shoulders because of that. So that's not an acute trauma, meaning something didn't fall on him. He didn't cause a tear that he noticed one time. He just started to get a stiffer and stiffer shoulder. It started to become extremely painful. It became very loose. Upon diagnostic imaging, tears were discovered. He could be helped to some extent. He hasn't done prolotherapy yet. I'm hoping that he eventually will. But again, it's simple. It's repetitive. It's stress on an area that causes tears. Now, what makes it a little more complex is that it might not only be one ligament or one tendon that's being torn. It could be several around the same joint. And they're harder to diagnose and harder to treat, and definitely require, in my opinion, and I think in the opinion of many good doctors, prolotherapists, prolotherapy doctors, you need excellent ultrasound imaging and the ability to read an ultrasound very, very well to isolate all those little tears around that particular area. And then you need guided imaging to get all those little tears and fill them properly with PRP solutions in order to get the best healing and recovery that you possibly can. I'll go into more detail later about what I've experienced and what I've learned about delivering prolotherapy, especially for repetitive strain injuries and failed compensation syndrome injuries. But just so that you know, it is really possible to cause pretty terrible injuries through repetitive stress. And if you're athletic, especially, and you're compensating and you're active and you've always got your circulation going, you're not going to feel that pain as badly. You might feel uncomfortable. You might feel like you get sore after activities. You might, like I did, deal with soreness and thinking, well, I'm a dancer. Of course, I'm going to be sore. A lot of my dancing friends complained of sciatica. "Oh, my sciatica is killing me today," or "it's better," or "it hasn't bothered me for months," or "no, it's back again." But nobody that I knew, at least in my circle of friends, got as badly injured as I did dancing. And that could be because, and I had other injuries that were not diagnosed that contributed to the sciatica, made it worse, maybe even caused it. It's hard to 100% know, but I definitely had more going on in terms of injury than they did, because they never really got injured and they could use physiotherapy and other modalities to control their sciatica and keep dancing, and I couldn't. So, you know, maybe they're experiencing muscle tightness or imbalance that they can deal with, but in my case, it was repetitive stress. So there are a lot of differences there. Let me please do a quick summary. I'm sorry it's a bit of a long video today, but the quick summary would be how you get diagnosed and what type of injury you have is very important to be familiar with in order to help you and your doctor look into a full history for you and figure out what the extent of your injuries may truly be, uncover injuries that are maybe not painful but are there, laxities along your kinetic chain, and also check along the kinetic chain if your prolotherapy is not successful in treating the one area that you know you should be treating. You've either plateaued or you didn't get 100% improvement and you expected to. Okay, so that's something that you want to look into. Was your injury acute and quickly treated? Was it acute and it took a long time for it to be treated? Did it come on gradually and feel more like repetitive stress? Could there be collateral damage? And what else along the kinetic chain might be damaged that you should address to get full healing for your most troubled area? Okay, I hope that this made sense. Sorry for being a little long-winded today. I'm going to leave some resources in the comments for you, specifically a link to Dr. Centano's books, Dr. Schultz and Centano's books on orthopedics. He's got several free PDFs that I highly recommend. One takeaway that I always use to understand and explain how injuries can happen that I got from one of his books is the metaphor of an axle. So if you consider your spine as being an axle, or any structure as being an axle, so it's a balanced structure and it has a very straight axle, you can take that out on the Autobahn every single day and minimal damage will happen. All the structures around it are organized perfectly around it to run properly, not bump into each other, not rub up against each other. Force is distributed evenly along all the structures as it should be in order for it to do the jobs that it's doing. And very little wear and tear or damage is possible. However, and I'll leave you with this as a final note, if either injury or your original slight scoliosis is being dismissed as a potential for injury or what could cause a muscle imbalance, I would say consider it again, because if you have that same axle, put it a couple of degrees off and take it out on the Autobahn every day, the more often you take it out, the faster you run it and the harder you run it, the bigger potential there's going to be for more dramatic damage and injury. So if you're a person that has a very mild scoliosis or has been carrying a long-standing mild muscle imbalance or injury, but you are engaging in very heavy physical activity, it's very likely that you're going to get repetitive stress injuries along the kinetic chain. For me, it's all through my left side. And you're going to need to look at the entire chain for a full diagnosis and probably the best prolotherapy treatment plan for you. So I hope that made sense. If anything didn't make sense, please ask me questions in the comments. I will be reviewing some of this information in the next videos as everything fits together. And again, thanks for bearing with me and watching me today. I hope you learned something useful. I hope that this is helpful. And I hope that you've all started your new year wonderfully. Thank you.